Well, in addition to thanking Tobias for not only organizing this, but for organizing all the clergy around this community on behalf of KNI, I also want to thank all of you. As a legislator, sometimes we work very hard on issues and nobody seems to notice. But I can speak for Vicki, myself, and the other legislators here. We know you notice, and we do appreciate the outward signs of support that you have shown all through this process, and I expect that you will continue way beyond tonight, and I can assure you that we will too. To tell you, when the governor, the last governor, created the Realignment and Closure Commission, I decided, because KNI was here and I knew that it would be a target, that perhaps I better go out there and take a look. I came actually, in my own professional career, I worked in a state institution in New York. It was for people with severe emotional problems, but I worked very closely with those who worked in institutions for people with developmental disabilities. And it was back, though, in the days, if some of you know about the Willowbrook consent decree, when they really made the decision that we would no longer warehouse our folks, but that we would put folks in the least restrictive environment and in the best environment that we possibly could. So I have to say that when I was making my first drive out to actually go visit KNI in depth, I really thought that I would probably come down on the side of closure. I was thinking back many years to what state institutions used to be and the types of folks who were warehoused in them, and I was thinking, well, this is probably what I'm going to find at KNI. And as you all know, it's not at all what I found at KNI. I found not only people with very severe, very profound disabilities and very medically fragile, but I also found an environment that was second to none, that is home, is truly their home. And the people who care for them are truly their family. So I walked away. I walked away with a very deep commitment to ensure that we maintain their home, that we maintain their family. And I can tell you, I serve along with Vicki Schmidt on the Senate Ways and Means Committee, which is the Budget Committee. So we know the numbers. And I will agree wholeheartedly with Dr. Sunby, it will not save the state of Kansas a nickel to close KNI. It will cost the state of Kansas very much money to close KNI. When they give you the figures of $160,000 per person to take care of a resident KNI versus 40 or 80 or whatever they use for community, they don't include so many things. They don't include the hospital that Dr. Sunby referred to. They don't include the outpatient services that are provided to people all across this region who need the posture seating clinic, who need the very special service, the dental clinic. They don't include any of those things. If you factor in all of those costs, you would bring that per person cost down considerably. And the other thing that they really don't include is that when you take them out of KNI, you will increase the amount of time that they're spending at our acute care facilities, and a day at acute care facility is far more for these folks than a day at KNI. So let's not buy the fact that it'll save the state any money. It won't. It'll cost them money. It'll take money out of the SRS budget, but it'll put it over in the Kansas Department of Health and Environment budget, where we'll be paying those increased Medicaid costs. So there's no good financial reason to close this, and there certainly is no good moral reason to close it.